Yeah, done. Start.
Okay. Good evening, everybody. I'm Rupinder, your host for today's live from All About Skin Allergy team. I'm sure all of you must be keeping good health. Today, we are going to discuss skin health with a focus on urticaria or hives, which we or our near and dear ones would have encountered at some time in their lives. Urticaria is characterized by a round rash on the skin that itches intensely. It may be due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is not known. As per a study published in the Indian Journal of Dermatology, more than 1/5 of the population suffer from urticaria, and 60% of patients are in the age group of 20 to 40 years. Well, urticaria is classified as acute and chronic, but the most important part is not to ignore it and do any self-medication because that can worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or a blessing if we can get to hear from an expert dermatologist online about urticaria and its types and how we can prevent it, what are the kinds of tests required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, we have with us a renowned dermatologist, Dr. Shweta S Swamy, live from Yogin's clinic. Dr.
Suchetha S Swamy.
Dr. Suchetha S Swamy, she is live with us from Yogin's clinic, Bangalore. Now, Dr. Suchetha will be talking to us about urticaria and its management. Dr. Swamy is a young and dynamic dermatologist and cosmetologist with more than 7 years' experience in the field of skin and hair care treatment, including general, cosmetic, surgical, and laser dermatology. Dr. Suchetha graduated from the prestigious Kempegowda Institute of Medical Sciences, Bangalore, and holds MD degree from Rajiv Gandhi University of Health and Sciences, Bangalore. She also has a postdoctoral fellowship in aesthetic medicine, Germany. She has been an outstanding postgraduate student and recipient of Dr. T.S. Sambasivan Award at 16th Annual Convocation of Rajiv Gandhi University of Health and Sciences, Bangalore, for securing a gold medal in the subject of dermatology and leprosy in the academic year 2013. Welcome, Dr. Suchetha Swamy. Welcome to this live session.
Thank you so much, Rupinder.
Dr. Suchetha, we would like to start with the very first question, that what is urticaria?
Urticaria is a skin condition where we see itchy rashes on the body. This can be light color or red in color, and we'll see tiny small bumps or swelling. It can come suddenly, it can come on any part of the body. It usually lasts for a few hours and it disappears on its own, and again it can come after some time. It is a quite common condition. Almost 1 in 5 person will have it at some point in their lifetime. Though 20% of the population can have it sometime in their lifetime. So it's always good to know how to manage it, what are the causes about it, and what self-medications we should not do so that we don't have the risk of getting urticaria.
Right. And doctor, our audience would like to know that what are the main causes of urticaria?
Urticaria, there are 2 types. One is the acute urticaria, one is the chronic urticaria. Acute urticaria is something where the symptoms, the itchy red rashes are there, which is less than 6 weeks duration. And chronic is something which is more than 6 weeks duration. In acute urticaria, the most common symptoms will be any infective focus like viral fever or any upper respiratory infections, or it could be because of any drugs intake, any tablets. Most common tablets or the drugs which can cause acute urticaria or allergic reactions will be the painkillers, NSAIDs like aspirin, ibuprofen, or antibiotics like penicillin group of antibiotics or sulfa drugs. So these are the tablets which we should not use as a self-medication. Suppose if there is any body pain, paracetamol would be the safe one. Suppose in emergency if we'll have to consume. So other tablets, it's not safe to take on your own. This is what, in general, people should be aware about. And other causes of acute urticaria would be food, most commonly food which have any preservatives or flavoring agents or colors in that. These are the most common food. And of course, other foods like eggplant, brinjal, or nuts or seafood. These are the common foodstuffs which can cause allergy, or sometimes exposure to any chemicals, or it could be dust, home mites, or pollens. These can also cause acute allergic reaction. Suddenly we start having these hives. This and chronic urticaria, the causes can be several. One is chronic spontaneous urticaria, means we will not know the reason exactly. Suddenly we start getting rashes, which is more than 6 weeks duration. And others are, we have specific reasons, like physical stimuli. It could be because of the sun. It could be because of contact with water, what we call aquagenic urticaria, or it could be cold urticaria, where we get the rashes on exposure to cold wind or cold atmosphere. Or it could be because of any pressure, like dermographism. If there is any blunt strokes, linear strokes on the body, we start getting swelling and redness along the streaks if there is any pressure on the body. So these are the few reasons. And there are other reasons what we have to be more concerned about it, if it's associated with any systemic symptoms like autoimmune conditions, systemic lupus erythematosus, or if it's associated with any thyroid dysfunctions, or it could be any chronic infections like acidity because of H. pylori infections or caries tooth, or any parasitic infections. So these are the things which are the causes of urticaria.
All right. Doctor, my next question to you is that how will we identify urticaria? How does it look like? Can we categorize it as an allergy?
Urticaria, the thing is, it is transient. It stays for very short time. We develop the symptoms suddenly. There will be itching and swelling. It could be light colored or blanchable swelling, redness. Randomly, it will come on any areas of the body. It could be of varied shapes. It could be annular, ring-like, or circular, or it can be very tiny, maybe 3-4 millimeter size, or little bigger size also. It comes, it will have a lot of itching, sometimes some burning sensation can be there. After a couple of hours, it will disappear on its own without leaving any marks. So this is the classical thing of urticaria. Suddenly we get itching, slight swelling, redness or paleness, which goes off on its own. This is the catchy point. In allergy, this, the rashes will not go off on its own. The redness, itching will continue. Okay, and we can also have associated oozingness can be there, scaling can be there if it is an allergy. So this is how we differentiate. And sometimes we'll have to differentiate it from insect bite reactions like mosquito bite or insect bite reactions. In this, the rashes will also be similar, like, red tiny bumps will be there, but it will be mostly on the exposed areas, like, wherever we are wearing the clothing, the areas which is exposed, those areas we have more bites, and even they don't disappear after a couple of hours. It will continue to stay. So this is how we can differentiate urticaria from other conditions.
So, doctor, we can then call urticaria as a serious disease?
Not a serious disease. Why it is of concern, and we need to discuss about it or create an awareness is acute urticaria, the appearance wise, a person is healthy, all going well. Suddenly, if they develop any rashes, swelling of the face, swelling of the lips, swelling of the eyes, the appearance make them get scared. Okay, so sometimes because of the reasons what I told for acute urticaria, food, drugs, or fever, if there is a sudden rash, one need not have to panic. You consult your dermatologist, and once the diagnosis is made, once the treatment is started, immediately within few hours, the condition will settle down. One thing. Second thing, with respect to chronic urticaria is, once the cause is ruled out, when there is no systemic associations like recurrent fever, joint pain, pain abdomen, or breathing difficulty, then most of the chronic urticarias are not associated with any life-threatening conditions or any systemic conditions, what we term idiopathic urticaria or chronic spontaneous urticaria. So these are not to be very scared about. Only thing is, it will stay for a long time. Most of the time, this chronic urticaria will last for almost 6 months to 1 year. Okay, Sometimes, rarely, it can go on up to 5 years or 6 years also. The thing is, suddenly a person is doing some activities, they are in their office or traveling, suddenly they'll start getting rashes, it will be bothering, irritation is there. So it's like any other chronic condition, it takes its own time to settle down. And the medicines what we use for urticaria are safe, oral antihistamines which are safe, which can be taken on a long run without any side effects. So one doesn't have to need to be panic about it once the diagnosis is made.
Okay. So, doctor, as you explained that chronic urticaria sometimes stays for 6 months or even a year, then how will it go away?
We don't know how it goes away. So we don't know why it comes. Okay. Most of the times, as I told you, there is specific reason like physical stimuli, sun or water or pressure. And most of the times we don't know specific reason, like, idiopathic we call, or chronic spontaneous urticaria. We don't know why someone gets it. So it takes its own time to settle down, and it varies from person to person. For some, it might be 6 months, for some, it might be 6 years also. And there are no specific tests or diagnostic features for us to tell for which person it's going to stay for how long.
Right. So, doctor, if left untreated, can there be any potential complications of urticaria?
Complication, it's not like it's going to damage any internal organs or damage the skin, but it will cause a lot of discomfort. There'll be a lot of itching and on free, severe scratching, burning, irritation might be there. So we'll have to treat it. One thing, most of the times this will be the thing. Sometimes if it is associated with a condition called angioedema, angioedema is a more deeper part of urticaria, where we see swelling of the soft tissues like the lips or the eyelids or sometimes the tongue and the throat. That will be a life-threatening condition. If it involves the throat and the tongue, we have to treat it immediately, because one person will not be able to breathe itself. So certain injections might be needed. So that condition has to be treated immediately. If it is just a rash on the skin, not involving any vital organs like tongue, throat, eyelid, or the lips, then it's not to be worried too much about it.
All right. So, doctor, as we know that stress is causing a lot of diseases these days. So, can urticaria be also caused by stress? And if yes, then does stress urticaria look a little different?
Stress can also cause urticaria, and it doesn't look different. So sometimes, like anxiety can cause a lot of sweating. That can give rise to something called cholinergic urticaria, where you see tiny, very small 5 to 6 millimeter red swellings on the body. So that could be thing, but for that you don't see any significant difference in the urticaria associated with stress.
Okay. So, doctor, as you've explained that urticaria or hives can come and go, there is no reason to it. So, what we've heard is that it gets worse at night. Is that true? And why?
There is no specific reason why it's more at the night. Probably will be more, more the entire day will be busy, occupied with our work, and nighttime is the time where our mind will not be occupied, and we might concentrate more on that. Or the one more reason is our body's circadian rhythm. Mornings by 8 o'clock, our body will produce corticosteroids normally, which will usually keep these, inflammatory mediators under control. Nighttime, as the levels come down, that could be the reason why we see more urticaria in the nighttime. Or it could be the cold. If it is a physical urticaria because of the cold, and night it could trigger, it could be the reason. Or else, as I know, I don't see like more urticaria in the nighttime in my clinical practice. I don't see this change in diurnal variation. I don't come across.
All right. And does this urticaria makes you feel fatigued or tired?
When the person is so much stressed out, when they have a lot of irritation in the body, the swelling of the hands and legs, yes, they get frustrated, tiring. Yes, it does.
Okay. Okay, Dr. Suchetha, if are there any dietary precautions that one should do, or what are the do's and don'ts for a patient of urticaria?
So, see, there are certain foods which is, see, urticaria, the pathogenesis, what exactly happens in urticaria is a chemical called histamine will be released because of any allergic stimuli. The mast cells, these are a type of white blood cells in the body. This will get activated and it will release a chemical called histamine. And this chemical will give rise to vasodilatation, lot of fluid accumulation, which gives rise to swelling and redness. It will also stimulate the nerve endings and causes itching, right? So histamine is the main cause in urticaria. So there are certain foods which have histamine and which will release histamine. So we need to avoid these foods whenever there is a risk of urticaria. But having said that, it's not a definitive thing that everybody who have urticaria will have rashes when they have this type of food. Suppose if a person has allergy to such food, it's better they avoid it. Okay, like banana, the big banana, not the small bananas, or mushrooms or nuts, especially the peanuts or the legumes, chickpea. These are the ones. Or seafood, any type of seafood can cause allergic reactions. Eggs. So these are the common ones which can cause allergic reaction. And as I previously mentioned, coloring agents, flavoring agents, any preserved fruit, preservatives which are used in the food, fermented foods sometimes. So these are the ones. Processed food, okay, something which is processed and stored for some time. These foods can cause urticaria.
Okay. Doctor, my next question to you is urticaria contagious?
Definitely no. It's not. It's an allergic reaction which occurs in one person. So it's not contagious. Yes, see, if the urticaria is secondary to viral infection, okay, suppose a person gets a viral fever and then they throw an allergic response, they will be infective because of the virus which is in them. Or else, if it is chronic spontaneous urticaria, they are not infective.
Okay. So, doctor, have we found any cases during COVID, or COVID can cause hives on the face?
Yes. Yeah. See, COVID is also a viral infection, right? Like any other viral infection. So yes, urticaria can occur because of COVID also.
All right. My next question to you is, doctor, that what are the treatment options for patients who have urticaria? What are the kind of lab tests that will be needed?
See, one thing is we need to find out the cause of urticaria. So we need to take a good history. Okay, if they have taken any tablets, is one thing what we have to do. And depending on the symptoms, fever, cough, cold, pain, abdomen is there. Specific investigations we have to do, like complete blood count is what we usually do to know if there's any focus of infection. CRP we do to know again if there is any focus of infection. ESR, which will let us know if there is any inflammation going on in the body. And we also do certain antibody tests like anti-nuclear antibody or thyroid function test, antibodies to thyroid proteins and thyroid peptides. We do that. Sometimes we also do stool examination, urine routine to find out if there is any infection. And depending on the symptoms, we have to do further investigations to rule out if there is any infections which involves the GI system, like H. pylori infection. So these are the basic tests we usually do in urticaria.
Right. Dr. Suchetha, we have a lot of viewers who have joined, and viewers have some live questions. So my first question comes from Neha Mishra. She's asking that in pregnancy, sometimes urticaria occurs. So which medicine is suggested in that condition?
In pregnancy, especially first 3 months is very crucial. We try to avoid as much as possible. Suppose if the urticaria is not cold induced, it's not because of any cold or water, then symptomatic relief, like using a soothing lotion like calamine lotion or using a cold compress, will try to manage the symptoms. And if there is any focus, like if it is because of fever, infection, we try to treat it and remove the triggers. If it's coming because of the food, once we stop the food, then automatically urticaria comes down. So we try to manage by not giving anything orally in the first 3 months of pregnancy. After that, also we try to avoid by ruling out the causes, removing the triggers. The safe ones will be cetirizine and loratadine. These are the two molecules which are safe in pregnancy.
All right. Doctor, our next viewer is Rajat Saxena, who is asking, what should be the focus of the physical examination for urticaria?
Okay. So one thing is we have to make sure it is urticaria only. One. Second thing is if it is associated with angioedema, we'll have to see if there is any swelling of the lip or history of lip swelling, swelling of the eyes, palms, soles, or if there is any breathing difficulty, to rule out any angioedema, because that has to be addressed very aggressively. Second thing is the rashes. Okay, are the rashes blanchable? When you press the lesions, hold it for 5 seconds and release it, does it blanch, or the redness still continues even after you put that pressure? And are the lesions lasting more than 24 hours? If it is lasting more than 24 hours, then it's not urticaria. Then it could be something called urticarial vasculitis, which has to be treated in a different way. So these are the things we usually look into when we are examining urticaria patients.
All right. The next viewer with us is Moni Jenny, who has a question that Moni has been having a case of urticaria since he was very small. So he says that he still has some minor symptoms. So the issue is that can he take the COVID-19 dose with this medical condition? Now, is there any screening test done before administering the vaccines for urticaria patients?
There is no screening test. See, one thing is we can do IgE levels, but if the urticaria is under control, it is very mild, then it's always better to take the vaccine in a tertiary care setup where they have facilities to manage if there is severe allergic reaction. So it's always better you take a vaccine when the urticaria is under control. See, few rashes once a week, if you are getting, or twice a week, very minimal rashes like 7-8 rashes if you are getting, then it's always better you take vaccine in a tertiary care setup.
All right.
And prophylactically, you can take oral antihistamines so that, the chances of getting rashes would be reduced before the vaccination and even after the vaccination. But you have to tell the treating doctor who is vaccinating you about this. So maybe they'll have to make you sit after the vaccine for an hour or two, observe you, and then send you.
Yes. Our next viewer, Namrata, is asking, can allergies or urticaria cause high blood pressure? No. Okay. And can I use over-the-counter medication? Or
one more thing I wanted to add, one more thing. See, certain tablets, AC inhibitors, which are given to hypertensive patients, can cause urticaria, but urticaria will not cause hypertension. So if someone is taking AC inhibitors, someone is put on AC inhibitors for hypertension, and after few weeks, if they develop urticaria, then you will have to see your physician. They might reconsider giving a different group of antihypertensives. Or if they have changed the tablets, someone is having hypertension from a long run and they have recently changed the tablets, then we'll have to see whether they have put them on ACE and then consider changing it. Yeah, that's one thing you have to know.
Right. Doctor, our next viewer is Aradhana Singh, and she's asking that, can I use over-the-counter medication or do I need a prescription drugs for urticaria?
It's better you see a dermatologist, because as I told, the causes of urticaria are several. So you need to make sure that any internal condition is not associated. So it's always better you start your treatment with a dermatologist, and then when you're on a taking tablets, if it's a chronic urticaria, if you're on medications, then see, we usually start with 2 tablets initially or 1 tablet, then slowly, depending on the symptoms, we reduce the tablets. When you're in that tapering phase, if you are like half tablet a day or alternate tablets, at that time, because of some trigger, if the urticaria rashes increase, then you can take the same tablet, you can double the dosage. In that emergency situation, you can do. But for that, first time you're taking, try to not medicate on your own.
Yeah, definitely. Doctor, our next viewer is asking that, why do I have hives that don't itch? Can that be a case?
See, usually when there is something called symptomatic dermographism. Okay, so there they have itching as well as rashes. Sometimes there might be not itching only, it is just a vasodilatation, but the histamine chemical is not released enough, which is stimulating the nerves to cause itching. That
Alright.
could be. Or someone who is taking antihistamines, then also itching will not be there. The rashes might come very few. So that also could be the reason.
Our next viewer is asking that can hives affect our eyes?
Yes, it can. As I told you, when there is angioedema, when the deeper tissue is involved, there can be swelling of the eyes also. Yes.
Okay. Our next viewer, Rohit Yadav, is asking that I have red spots on my hand. How can I reduce it naturally? He says that almost 1.5 years has passed and the redness and itching is increasing day by day.
We have to make sure whether it is really urticaria. If it comes on and off, like the symptoms what I told, then you'll have to take antihistamines on a long run. But if the redness is continuously there, it is not like coming and going, then it could be something else. So we'll have to see, diagnose, and then treat accordingly.
All right. I think we'll have to wait for a few more viewers who are sending us some more questions to answer. Anything else you would like to elaborate on the lab tests or the test procedure of detecting urticaria as well as treating urticaria?
There is other tests what I told, and one more thing what we do is something called ASST, Autologous Serum Skin Test. So this we do when we suspect autoimmune urticaria, means our own body will produce certain antibodies which will react against our own mast cells and produce the histamine. So what we do, we draw patient's own blood and take out the serum and we inject on the skin. After 15 to 20 minutes, if there is a hive at the area of injection, then we term it is ASST positive. So then we confirm that it is autoimmune urticaria. This is one extra test what we do. And sometimes if we suspect any food allergy or any allergy to some chemicals or pollens, then there is something called allergy test. Serum Ig levels we find out specific to certain allergic agents, or we also do something called prick test. Okay, there will be a panel of most common allergens we come in contact with. It could be dust, it could be mites, or it could be some plant products, pollens, or food. These small agents are placed on the skin and tiny prick is made, and we take the reading if there is any allergic reaction. So this is one test what can be done. So these are the tests we usually do. And what I would like to stress to the viewers is chronic urticaria, once the diagnosis is made by a dermatologist, one thing we have to know is it takes its own time, and we don't know for which person it will take how long. So one has to accept the condition and take the medicines on the long run. Don't stop it on your own. Gradually, you go on a tapering dosage. Once the tapering, when you're in a tapering dosage, suppose because of any triggers, if there is an allergic reaction, for a couple of days, you can up dose. Take the tablet twice a day, then slowly make it once a day, then half a day, and go back to the regimen what you were taking, like half a day or 2 days in a week. Do like that. So you don't have to panic or get frustrated. See, we accept when we have diabetes, which is chronic. We accept when we have hypertension, when it is a chronic condition. We control diabetes. We don't treat diabetes. We cannot make it go off. In the same way, chronic urticaria also, we can control it with antihistamines, and it takes its own time to completely settle down. So we need to accept it, and we need to take precautions. And suppose a person who has this tendency for urticaria, I would suggest you see, there are certain triggers like what I told you. Try to avoid certain food, or try to avoid coming in contact with dust. If you have a lot of carpets or cushions, furnitures in your house, curtains, try to get it vacuum cleaned regularly so that dust doesn't get accumulated. And try to wear cotton comfortable clothes, because synthetic wool are usually irritants. They can precipitate. and try to carry an antihistamine, an extra strip of antihistamine, levocetirizine or desloratadine, whatever the doctor has prescribed you, with you wherever you are traveling. Sometimes any trigger can cause the breakout. So if you take the tablet immediately, then it will bring the symptoms to control. So this how you'll have to manage and accept it.
That's quite an information for our viewers, Dr. Suchetha. Thank you so much. And it has been a very informative session for our viewers. And I'm sure that our viewers will use this information to prevent themselves and their near and dear ones from getting urticaria. And we also know that in case they have any symptoms, they see any symptoms, they now know that instead of self-medication, it's better to approach a nearby dermatologist. Well, it's great to hear from you, Dr. Suchetha, and we really look forward to many more such sessions in the coming times with you for our viewers.
Thank you, Rupinder.
Viewers, if you want to consult Dr. Suchetha S Swamy, you can visit Yogin's clinic at MLR Complex, Bangalore. And
Main Road, Bannerghatta.
I would request Dr. Suchetha if you can give out the address once again, please.
Yeah, I'm Dr. Suchetha S Swamy. I'm a dermatologist and cosmetologist. I work in Yogin's clinic, Bannerghatta Road, Bangalore.
Right. Thank you so much, Doctor. And thank you to viewers for your participation in today's session. And to get the latest updates on how to keep your skin healthy, do like and follow our FB page, all about skin allergy. We are also available on YouTube, Twitter, and Instagram. Thank you and good day.
Thank you. Thank you, Rupinder. Yeah. Thank you, all the viewers. Thank you.
Thank you.